My name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and that they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Approximately 20% of breast cancer cases are diagnosed in women under 40 years of age, a notable shift from what was previously known as a disease that normally is a struggle among old women in Africa. Interestingly also, this condition is not just a disease for the women. We have seen cases rising among the men. This is the Breast Cancer Awareness Month, the month of October, and it's incumbent among all of us to know how we can stay informed, take proactive steps to end this fight against breast cancer. Welcome to the Healthy You program, your favorite health show on Faith Today television. My name is Enock Kitondekijja, a medical clinician and your host. Allow me begin by recognizing JCK Hospital, the official sponsors of this program. You can find them in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. They are also in Juja Farm and Mariaini. The goal is to impact you with information concerning your health holistically, so you can be built up in your mind, body, and soul. Today's topic is the war against breast cancer, and the argument is, what is your role in this? And to help us disburden this condition is a medical doctor from JCK Hospital. He's among those on the front line of diagnosing, managing, and help us get this disease to the bottom end. But before I invite him to take us to the next level, I am aware we have those of you who are following us on social media, that is Facebook and YouTube. We recognize you and we celebrate you. I want to remind you to subscribe. Please like, share this conversation with someone else. You don't know who you can help with this information. And for those of you who have questions concerning breast cancer, you better send them now, because the earlier the better. We have an expert in the building, and you don't want to miss this time with the doctor. Thank you. Back to my guest here. Doctor, you are welcome.
Thank you so much. Thank you guys for having me. My name is Dr. Omondi.
Okay.
I'm a medical officer based at JCK Hospital. It's along Lumba Drive, as you said. I'm happy to be here.
Wow, you're welcome. Before we start, I just wanted to get a view of how your weekend was. Was it even a weekend or a public holiday?
Yesterday,
how was it like?
I was busy at work yesterday.
You were busy when people are resting?
Yes. We don't have breaks, apparently, so diseases don't take breaks.
Okay.
So we're always at work every single day with a few breaks. So in the hospital, every time you'll come, there'll be someone to tend to you. So fortunately or unfortunately, yesterday was my shift, and
okay.
Yeah, I was able to cover it despite the public holiday.
Well, for those of you who are just joining us, this is so interesting to note that these doctors, yesterday, as you're celebrating, as you are having fun, they were on the front line fighting so hard that you get the best medical services that you need. He says diseases do not take a rest. So it is important that we have a very quality time with him. So stick with us up to at the very end. And this is Dr. Austin. Doctor, you know, we are in the month of breast cancer awareness.
Yes.
We're trying to, you know, this war has been here with us for more than, 50 years, or so. And so we would want to know, you at JCK Hospital, you guys, what are you doing to spread the awareness and also help us conquer or win this war?
That's a very good question. We've been having periodic awareness videos. We've been sending them out as JCK Hospital, as well as the medical team and the clinical team, and then also having this show as well. Also, we have, during this breast cancer awareness month, we're going to have all the screening services done at half price. So welcome, guys. The message is just out there. If you live around Lumumba Drive or just Nairobi as a whole, just come through. We will be able to screen you at half price. We're also having a dental services as well, also being discounted for this entire month. So come on, come on. But today the focus is on breast cancer and its awareness.
Wow.
So as we know, breast cancer is among the top 5 cancers in Kenya and among the top 2 cancers in women in Kenya. So the incidence is about 1 in 8 women have the risk of getting breast cancer throughout their entire lives. That's not to say that men are not affected as well. However, the incidence in men is a bit low. It's around 1 to 1,000. So it's predominantly a woman's disease, but not to say that men also cannot get it. So we just want to put the message out there that women are the most affected. However, men can also be affected. So yeah, that's very good to start, just put it out there that men are also affected.
Okay. Well, that is interesting to know, because I know there are viewers there who might think, because we did send the word out there that today we're going to be talking about breast cancer, and by default people thought that it's going to be just a talk about women and things like that. But when you give us a clear understanding that men also are involved in this, then that is something serious. And I believe it's going to be an interesting conversation.
Yeah, I believe so too.
And of course, Doc, this being a very serious disease that is contributing to very many deaths, we really want to reduce the death rate, the mortality rate, because, I want you to give us an overview about this breast cancer. What is it all about?
So breast cancer, allow me to talk about the breast as an organ to begin with. So the breast is predominantly an organ made of mostly fat, but then inside the breast there are things called lobules, and then within the lobules are the ducts. So the lobules are what produce the breast milk, and then the ducts will obviously carry the breast milk through. They're all connected to the nipple, which is the pointy thing. I believe everyone knows what a nipple is. Yeah. So in the breast also there's something called lymph nodes. So the lymph nodes are connected also to the general lymphatic system in the body. So the lymph nodes help the body to fight infection. So breast cancer, the most important part, or the most common type of breast cancer, 1 starts in the lobules and 2 starts in the duct. So that's the most important thing about the breast as in general before starting about the cancers. So when it begins in the lobules, it becomes lobular invasive carcinoma. Okay, it starts locally first in the lobules, then if it goes outside the lobules and affects the surrounding cells, it becomes an invasive lobular carcinoma. If it begins in the duct, it's a ductal carcinoma, then it becomes invasive if it goes beyond the duct. Usually what happens with the breast cancer, it will end up seeding. What we call seeding is the lymph nodes will end up carrying like seed cells, where if the seed cell are moved to another part of the body, it will grow breast cancer in a different part of the body. For example, if the breast cancer begins in the lobule, it might move to the lymph node. One lymph node is in the breast. The next lymph node will go towards the axilla, that is the armpits. Then it can move to other parts of the body. The most common parts are the lungs, which is very close to the breast.
Yeah.
From there, it can go to the bones. Another very common site is the brain. Another very common site is the liver, which now brings me to the signs and symptoms of breast cancer.
Yeah.
How would I know that I have breast cancer? So the signs and symptoms of breast cancer are really dependent on the stage, whether it's early stage or later stages. So the more breast cancer advances, it has what is called metastasis, which is to say basically distant spread to other organs. So predominantly, breast cancer can be caught very early through clinical examination or even self-breast examination. So usually, if you're at home, every month, it is advised that any woman if you're in the reproductive age, you should start looking at your breast every single month. The best time to check is 3 to 5 days after your period. Why 3 to 5 days, you might ask? So during your period, usually the breast might feel a bit tender. You might feel a bit of the lumps, the normal lumps in your breast might be a bit bigger. So after the periods, that really tends to go down. So you really cannot confuse any mass. So the first thing you need to do is to check for any abnormal lumps. When a woman feels her breast, usually starting from the outer quadrant, you check in a rather circular motion. If you notice any unusual lump in your breast, usually it's a firm mass, a bit irregular. It could be non-tender. Non-tender means not painful. So when you notice that kind of lump, it would be advisable for you to come to hospital and let the doctor check it out. Other very common signs and symptoms would be if you hold your hands against the back of your head like this. Usually the breast, if you look at the breast, if one breast is a bit tense, meaning one is hanging above, another is hanging below, that could be a telltale sign that you might be having the early symptoms of breast cancer. The other thing you might also want to do is to look at the skin changes around your breast. So for the ladies, if anybody is confused about it, your breast starts having something called dimpling. So it usually resembles the cover of an orange, the orange peel. So if you have that kind of dimpling and wrinkling of your skin, usually it's a telltale sign that you might be having breast cancer. The other thing is, as you all know, some people most nipples point outwards. That is, they're everted. So if you have a new onset inversion of your nipples, I'm saying this one because some women naturally have inverted nipples. But if your nipples are usually everted like most women's nipples are, and then suddenly they start pointing inwards, that's a telltale sign that you might be having an early form of breast cancer. The other thing also, things like a discharge from your nipples. Usually with breast cancer, the discharge becomes bloody. So if you notice a blood-stained discharge from the nipple, the next step you need to do is to go to hospital. So the other symptoms are really dependent on the advanced stages, just so that I can just talk about it, because there are very many women right now who are living with breast cancer, and it's a very serious diagnosis, causing so much anxiety and mental turmoil. So if the breast cancer has spread to your liver, you'll get symptoms like abdominal distension. You have things like nausea. You can have things like your eyes turning yellow with what is called jaundice. If it goes to the bone, you can have things like bone pains. If it goes to the common signs like the brain, you can have headaches and seizures. If it goes to the lung, of course, you can have things like cough. Whenever you cough, you'll notice that there's blood in your cough. So it really depends on the level of advancement of this disease.
Wow, that is interesting. Yes. I've let you really give us all that you carry. And something that is really outstanding for me is you've talked about how this disease spreads, you know. And you've also highlighted that as long as someone has a breast, they are candidates of, breast cancer.
Sure.
You've talked about the ducts, you've talked about the lobules, you've talked about it invading other tissues, meaning, because that is what cancer does, it spreads. You've also helped us understand that early detection can do something. So what difference, because I believe my viewer today wants to understand, what difference does it make when you detect this cancer early? Because you're always talking about early detection and things like that. What of the difference does it really make?
That's a very good question. So the difference that it makes, basically it improves survival rate. So the more a cancer spreads, it becomes more invasive and aggressive. So that means the more places it has gone to. You see, when it's in when it's just starting, if it's in a small area, which I'll talk about later when it comes to management, simple things like a surgery would help, then followed by chemotherapy and radiotherapy. But if it has spread all the way to advanced disease, then surgery is usually not advised. And then it's more of a palliative care and trying to lengthen your life rather than total remission and total cure. So usually the earlier the better. And you will see when I was talk about the treatment options, how early detection might help. So even before we talk about the detection and whatnot, we need to know who is at risk of getting breast cancer.
That's very important.
So so the predisposing or the risk factors. So number one, as we said, just being a woman would mean you're at a higher risk of getting the breast cancer. Number two,
and also being a man.
Also being a man, but mostly being a woman. So because the incidence is a bit higher in the women. Number two, women who have very early, it's called menarche. So when you begin your periods very early, let's say 9 years or 8 years, that means you are at a higher risk of getting breast cancer. Women who get to menopause very, very late. If you end the menopause, let's say at 50 or at 60, the people who get even menses all the way to 55. So late age of menopause is also a bad thing, because one of the hormones that is really involved here is estrogen. So higher levels of exposure to estrogen would increase your risk for getting breast cancer. Use of things like hormonal contraceptives, which contain this estrogen, things like the COC that the women take like as a contraceptive method.
Family planning.
Family planning,
They normally call it family
planning, yes. That one would increase your risk for breast cancer. The other important thing is a family predisposition. If someone in your lineage, your mother, someone else, or your grandmother had breast cancer, or your sisters, or any first degree relative, you are at increased risk of getting breast cancer. Other things are genetic.
I want you to help us understand, Doc. You're really giving us valuable information, because I understand there's a viewer who wants to know, because when they hear family history or predisposition, they think that as long as my sister or family member had breast cancer, then I'll also have breast cancer. Is that true?
That is not directly true, but your risk is higher. So what usually happens, if at first degree relative of yours had breast cancer, it will be very imperative that you come to the hospital where you can do things called like genetic testing. So some of these genes, if they are found in you, like quite famously, there's an actress called Angelina Jolie. She had relatives who had breast cancer. She decided, she went to the hospital, and she was tested that she did have the gene for breast cancer. She said, I will not wait for the breast cancer to come. So she had the breast removed even before the breast cancer got to her, or rather developed. So you cannot get breast cancer without a breast. However, there are also other methods, like I know the breasts are a sensitive thing if they're removed. There are surgeries which can reconstruct a breast, so not to worry.
Absolutely. I think that is what my viewer wants to understand, because you can't imagine you losing your breast tissue. I also wanted to understand, do you guys reconstruct, and can I carry on with my normal activities as a woman when I have something artificial?
You are okay. Things like breastfeeding will have to be altered. But however, if we'll fix things like aesthetics, you can be able to wear your bra, because women really have to have the breast. It's more of an aesthetic thing, as well as also psychological thing. So yes, we can't reconstruct the breast. They will not meet the biological needs, but at least psychologically and from the outlook,
they will live longer.
They will live longer,
Talking about living longer, what are the survival rates looking like because you realize some of the information you consume on media, and this is the public domain, they say 70% of the cases in Africa mostly that present are in the late stages. People really take long. What do you have to talk about that?
I think the reason why Africans have a lower survival rate is because most of us catch the breast cancer really late. So what you can do for that is just improving your health-seeking behavior. So whenever you see something wrong, it's very imperative that you just go to hospital. Because Africans have this mentality of, I'd rather not know, or ikinilemea sana, that is when I'll go to hospital. So just improving that kind of health-seeking behavior would improve survival rates, because if it's in the earlier stages, survival rates are extremely high. Extremely high. Above the 70s, above the 80s, above the 90s. That is even 10-year survival rates. They're extremely high.
I think this is good news for our viewers. If you're following this, a doctor is telling us in a nutshell that breast cancer should not be a death sentence, like most of you have been, have been exposed to. So catching this show, it's very important. And I want to remind you once again, if you can share this link with someone else, we are in the month of breast cancer awareness. The fight is involving all of us. And before we go into the next step, I want you to share this. Share this. The awareness goes on up to the entire month. Don't leave anyone behind. We are all involved. Thank you. I know you're doing the right thing. Daktari, in just a few minutes before we take a break, because I know our viewer wants to understand, how do I get to the bottom of this? How do I prevent? They want to know, they want to have an image of probably a woman doing an examination. We are going to do that, by the way. We have a video, so stick with us. We are working with JCK Hospital. They are making that possible right now, so do not change the dial. Take us through the management. How does the management look like, more so in the early stages and then the late stages, briefly?
Okay, that's a very good question. The management options for breast cancer are very wide, and it's a multidisciplinary approach. That is, you'll need several doctors with different specialties to be able to manage this breast cancer. Some of the available options include, number one, surgery, and even the surgical options, there are very many options to which surgery can be done. You can have something like a lobectomy, just removing a small lobe.
Something that you've identified cancerous.
Yes, you can
remove take it away.
Yes.
Good.
You can have a simple mastectomy. That is just removing the breast tissue that is involved. You can have a radical mastectomy, removing the breast and the other lymph nodes where they usually go seed. So usually the management options are very, very many. That is the first one, called surgery. Number two, you can have radiotherapy. That is having the radiation, in very simple terms, the radiation which will come and hit the particular cells and kill them. Number three, you can have another option called chemotherapy, where it usually can be an IV, can also be oral. So you're taking dangerous, I call them dangerous or rather strong drugs that are going to kill the cancer cells. Okay, so cancer cells are highly multiplying cells, and these drugs usually target the very, very fast multiplying cells. That's when you're taking chemotherapy, the very fast growing cells, things like the hair cells, tend to be lost. Okay, then there are other options like hormonal therapies. Okay, because some of this breast cancer are estrogen receptor sensitive, others are HER2 new, that's a bit more complex, but you can also have hormonal therapy, things like tamoxifen as a management option. You also have something called combined therapy. So you can have early chemotherapy just to shrink the cancer cells, and then you get a surgery, or even after the surgery you can also get something like a radiotherapy. So the management options are very vast. But then if it's very advanced in the later stages, then surgery is not advised. We just go into what is called palliative care. Basically, it's adding more days. Not necessarily adding days to your life, but adding life to your days.
Adding life to your days,
not
to improve
days.
the...
Yes.
Okay.
Basically, we want you to live pain-free, just adding a bit more of life and a bit of human decency to your life, not just being in pain throughout the whole time. And that is why we really advocate that the earlier the disease is caught, people get into remission. And we've had cases of very many people who have lived 30, 40, 50 years, even after suffering breast cancer and having a breast cancer diagnosis?
A moment of silence for that. It's really interesting, but also challenging, because when you really get to understand that the survival rate is high, but
If
only
caught early.
high if caught early. So meaning we put these people at a very challenging position if we come in late. And you know, surprisingly, we are in a society whereby as long as something is not painful, people don't take it serious.
They don't take it seriously.
You know, in a society whereby until someone is seeing a wound, they don't take it serious.
They don't take it seriously.
The people they have their quick fixes. He realizes maybe something, a wound or a change, then he goes to do they call it
Cosmetic.
Yeah, you know, they try to change their appearance, not knowing that they are masking something.
Something else, yeah.
Something huge.
So that's why right now we're even advocating for the men. If you notice the breasts of your wife or your significant other or your girlfriend has had a change, please tell her. Because nowadays the advocacy goes to both genders. Because if you notice the change, put pressure or just advise your lady to come to hospital. I have seen this one happening even in my own practice, where a husband noticed a change in the woman's breast. The woman was like, it's just a small change, it's nothing big. But the husband insisted that, no, I think there has been a change in your breast, and I feel there's a new lump here, and the skin has changed a bit. Just go to hospital. Alas, when they came to hospital, they found that they had a diagnosis of breast cancer. So the men also have an active role to play in the screening of these breast cancers.
Wow, this is very interesting. And you guys who are following us, you really know now that it's no longer about the women. Your spouse is equally involved in this fight, because the earlier you identify some of these things, the better. Doctors are pushing this, and I think it's good for us. This is Faith Today Television, guys, bringing you the Healthy You program. We are hosting a medical doctor from JCK Hospital, loaded with so much worth of information that you need to know. I see your questions coming in. That's good. If you have not yet sent in your question, please do that right away. Keep these questions coming. And Dr. Ali,
Yes.
Before we take that break, someone is saying, good morning, please explain how breast cancer stage is determined.
So
should we answer it right now, or we answer this person when we return?
We can answer it after the breakdown. It's a big breakdown. We can answer
this is a big breakdown. So
yes.
Luis, stick with us. We are going to handle this when we return. So for those of you who are watching this, we are going to show you something small from JCK Hospital. They have sent us something is going on. They want us to know how you can do this breast examination at home. Even your partner, the doctor here has alluded to the fact that you need to everyone is involved. Your husband is involved in this. Your sister is involved in this. So we are going to show you how you can practically do this at home, you know. So stick with us, and thank you so much. Thank you so much. We're going to take a short break, but stick with us. Let the questions keep coming. God bless you.
Hi ladies and gentlemen, I want to demonstrate how to do a breast self-examination. For the women, if you still receive your periods, do the examination after your periods are over. And for the women who are menopausal, you can do it any time of the month. It is important to do monthly examinations. So the first step is to look at your breast after you've left the shower. Stand in front of a mirror, look at your breast, see if there are any changes in the skin. If you see any abnormal skin changes, any difference in shape or size, any ulceration of the skin, you should go for an examination. You also lift your hands up like this, see if there's a difference in how they rise. That is also a sign that there might be a problem. So the next step, you use this part of your fingers, 3 fingers. You start on the outer region. So you examine gradually and slowly as you go medially, like that. And also on the opposite side, the same thing. You're checking for any lumps, any pain, any issues. Then you also check, there's something called your lymph nodes that are here. you press and you'll feel a swelling in the armpit region on both sides. You also check your nipples for discharge, so you press them, see if there's any fluid or any blood coming out. So then the next step, you lie down. Then now you examine the lower part of your breasts. So you lift your hand up like this, then you examine the lower part on both sides. Yes. So basically that is the breast examination. It's very simple and straightforward. If you see any issues, notice any issues, feel any issues, come to the hospital. Thank you. Hi ladies and gentlemen, I want to demonstrate how to do a breast self-examination. For the women, if you still receive your periods, do the examination after your periods are over. And for the women who are menopausal, you can do it any time of the month. It is important to do monthly examinations. So the first step is to look at your breast after you've left the shower. Stand in front of a mirror, look at your breast, see if there are any changes in the skin. If you see any abnormal skin changes, any difference in shape or size, any ulceration of the skin, you should go for an examination. You also lift your hands up like this, see if there's a difference in how they rise. That is also a sign that there might be a problem. So the next step, you use this part of your fingers, 3 fingers. You start on the outer region. So you examine gradually and slowly as you go medially, like that. And also on the opposite side, the same thing. You're checking for any lumps, any pain, any issues. Then you also check, there's something called your lymph nodes that are here. You press and you'll feel a swelling in the armpit region on both sides. You also check your nipples for discharge, so you press them, see if there's any fluid or any blood coming out. So then the next step, you lie down. Then now you examine the lower part of your breasts. So you lift your hand up like this, then you examine the lower part on both sides. Yes. So basically that is the breast examination. It's very simple and straightforward. If you see any issues, notice any issues, feel any issues, come to the hospital. Thank you. Hi ladies and gentlemen, I want to demonstrate how to do a breast self-examination. For the women, if you still receive your periods, do the examination after your periods are over. And for the women who are menopausal, you can do it any time of the month. It's important to do monthly examinations. So the first step is to look at your breast after you've left the shower. Stand in front of a mirror, look at your breast, see if there are any changes in the skin. If you see any abnormal skin changes, any difference in shape or size, any ulceration of the skin, you should go for an examination.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu akaniambia, nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi, maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika kitabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba na naweza kuwasiliana na wewe, na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed. Thank you.
Hello there, my name is Enoch. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show.
a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Welcome back to the Healthy You program on Faith Today Television. Today is a special day. We are again hosting an expert from JCK Hospital, a medical officer, Dr. Austin. He has given us a good understanding of breast cancer. He has also helped us understand that this is not a death sentence. The earlier you detect it, the better you can really deal with it. The fight is real, and we are all involved in this. He has also highlighted the men. You have a role to play in this. And now this second segment, we are really going to focus on prevention. We are going to help you understand how you can prevent this disease, how you can deal with it, how you can live healthy, even when you are diagnosed with breast cancer. But before we go any further, we left it at a certain interesting question that I believe Louis wants an answer to its doctor. Louis is saying, good morning. Please explain how breast cancer stage is determined.
Okay.
Thank you.
So the staging of the breast cancer, usually that will fall under part of the diagnosis. So when you go, that is the screening and diagnosis. When you go to hospital, after the self-breast exam, for example, you get a node.
Yeah.
The next step, you'll come to hospital where the doctor will do now a clinical breast exam. After the doctor does a clinical breast exam, they'll tell you that this node most likely isn't cancerous, but these changes might be cancer. So let's go to the next step where they're saying that you do have a suspicious changes in the breast, for example. The next thing, you'll either do a breast, depending also on the age, you do either a breast ultrasound, a mammogram, or a breast MRI. So for the older women, they tend to do a mammogram. The younger one will do an ultrasound. So from these two tests, if they see any suspicious changes, they can now upscale into the breast MRI. The breast MRI will pick up things that the mammogram or the ultrasound will not pick up. Now from there, let's say that they notice that you do have metastatic changes, that is cancerous changes, that is. So from there, the doctor that would have diagnosed you would refer you to go get what is called a biopsy. Biopsy is where they take a small chunk of the cancerous cell, then go and examine them. So now the surgeon will take the biopsy, then...
The biopsy meaning, you know, in the layman, we call it, is it the meat?
Yeah, they'll take a small piece of the meat. Of the cancerous meat.
Of the cancerous meat.
Yes, then take it to a special doctor called a pathologist.
Okay.
Where a pathologist will now examine it again under the microscopes. They do their own testings. Then they'll give you a final report. Usually a breast cancer report will tell you whether the cancer is sensitive to estrogen, progesterone, or the HER2 new receptors. Yeah. So they check, it's really a detailed report. Then from there you have what is called a staging, that is the TNM classification. You look at the tumor size, the number of nodes involved, and the distant metastasis, which is the distant spread. All these things are very complicated. So for the layman, that will not be really important. That is now for the doctors to worry about.
To take their course.
Yes. But now when they look at the cells, the grade 1 to 3, where 1, there is a cancerous change, but the cells are very close to normal. Yeah. And then 3, now the cells have really changed. They are dysplastic, and now they are fully cancerous cells. Yeah. Yes.
Oh, this is interesting. For those of you who are following this, doctor is making a call to action, kinda, that some of these things you're not going to do them from home. You know, yes, the first step is you doing the breast self-exam, like we have showed you on the video, and of course with other more engagements that like we're going to have. It's important that it is a stepwise approach, like he told us. Do the exam. If you're not yet sure or comfortable with the results, there's a clinical exam that these people have to do. It's not you who does it. Then they go into the investigation. You know, that is when they go take, maybe do an ultrasound. He talked for the older women. There's a certain kind of scan they do.
Mammogram.
You know, a mammogram. That one. You may not understand it, but what you know is that they do that. They know what they do. And then the last stage is probably getting a piece of meat to just ascertain whether this is really cancerous or not. And if it is not, if it is to be removed, they can remove. If they are going to remove it, they are going to advise you. That is very important. We can't do all these things from home. Thank you so much, Doc. And I love the way you are driving this. I am sure that our viewers are getting so much substance from it. Questions are coming through, and we want to appreciate all those who are engaging. This is Faith Today Television. And then I have Jonathan saying, can men get breast cancer?
Yes, they can.
Did we answer that last time?
We did answer it when we began, but I'll just repeat again for the viewers joining us right now.
Jonathan.
The incidence of breast cancer in men is a bit lower. It's about 1 in 1,000. So the number is not 0.
Okay.
However, in women, it's about 1 to 8. So the simple answer is yes, men can get breast cancer.
Okay.
Yes.
Good, thank you. Jonathan, if you just joined us in the second segment, we had so much content for you summarized in the first segment. So go through it, and then we have, this is, she didn't give us the name, but if you would give us your name and where you are following this from, it will help us even follow up and make sure you get answered. Hi, hi, let's get another one. I am Irene. Am I at risk if my family has had several cases of breast cancer? My grandmother had, 2 of my aunties, her children had.
So that is, in fact, that is one of the most important risk factors. If you have first-degree relatives in your family who've had breast cancer, there's a high chance that you will develop breast cancer. So a lady like that might come to hospital. We will do the screening and the genetic testing, and then now based on what is called informed. You can give an informed consent. Then she can accept maybe to remove the breasts. If she has, for example, if she has had children, she can now decide, you know what, instead of waiting for this breast cancer, I can have my breast removed. Famously, like I said, Angelina Jolie.
Yeah, that example.
Yes, so yeah.
Okay.
She's at a very high risk, and not to say that she will get it, but she's at a higher predisposition of getting breast cancer.
You know where I come from, the house of faith.
Yes.
We say knowledge is power.
Yes.
My people perish because of lack of knowledge.
Yeah.
But now that you know, you have this information, the doctors can advise you on what you can do.
Yes.
That's very interesting. Perfect. And then someone here is asking, good morning, at what point do one need chemotherapy? Are there any side effects of chemotherapy? Thanks.
So it really depends on the stage of your breast cancer. So chemotherapy, like we said, can be given before surgery. That's called neoadjuvant chemotherapy, and after, called adjuvant chemotherapy. So what the chemotherapy basically does, chemotherapy targets very fast growing cells. So when you're given the chemotherapy, it will shrink the cancer tumors. Then you go in, do a surgery, then do another round of chemotherapy just to clear anything else that might have been left, or any cancer cells that might have seeded anywhere else. The chemotherapy will go and clear them, because it really targets the fast growing cells.
Cells, yeah.
You might ask, what is the effect of chemotherapy? Like I said, it targets fast growing cells. Things like hair loss will occur. A patient, some of them become really thin. You can have like anemia. So the effects of chemo are really, really broad. Okay. But overally, we look at the benefits,
outweighing
the risks, basically.
Wow. Well, that is good. Thank you so much, Doc. People are really enjoying this show. I am seeing very many questions. Yeah. I hope I answer you, my viewer. And then I have Joshua in Thika asking for a stressed friend. Are there complementary therapies available for her while receiving treatment? That is Joshua in Thika.
Okay, so I don't understand the question directly. I'll try to answer it to my best.
Yeah.
So complementary therapies, so you have things like just counseling as well, that's a complementary therapy.
You talked about multidisciplinary
approach.
Carry on.
So things like counseling are very important so that you don't give up. You also have things like pain management, because usually these treatments are usually very aggressive and also very painful. So you have things like pain management. That being said, the treatment options are very many, from chemotherapy to radio to surgical treatment, as well as hormonal treatment, and also combined and targeted treatment. So it's really multidisciplinary.
Wow, Joshua, you get the answer. These people have a lineup of treatment options for you. Yes, and do lymph nodes have to be removed?
No, it really depends. If there is, what they usually do is they check whether the lymph nodes have been affected. So if it's in the early stages, they don't have to be removed. But if it is in the later stages, they will have to be removed, because this cancer cells usually, like I said, they get seeded. So imagine a lymph node that is holding the seeds of this breast cancer. Then you go ahead and remove the breast and leave the seeded cancer cells. What that will do is they'll leave that place, go and travel to another part of the body, implant there, then cause another cancer. So if the lymph nodes are affected, yes, they do have to remove all the lymph nodes all the way to the armpits, that is the axilla. So yes, sometimes they do have to be removed. Yes.
Oh, this is interesting, guys. You get to understand that if the risk is outweighing the benefit, the doctors know what to do. If the benefit is outweighing the risk, then you can go ahead and do whatever they advise you to do. Daktari, shifting gears, you know, in this battle fighting breast cancer, it's not only the patients who are affected. I understand health workers who are at the front line, like you are, could have challenges. Can you take us through some of these challenges that you guys face?
Of course, it really depends, because some of these patients really come at a later stage, and just losing patient in itself has a psychological effect on the medical practitioners and the medical doctors. So that's one of the challenges. Number two, there are not enough cancer centers in the country. There are very few. So that is where now the government policies can try to increase some of these cancer centers. Also, there are very few oncologists who can deal with these cancer cases. So having more numbers of oncologists will really also help us in the battle against breast cancer. Yeah, so it's just small things, and it really goes down even to things like blood transfusion, availability of this blood sometimes, because some of these patients have very few relatives, and then also just availability of blood, because such small things would really delay when these surgeries can occur. So yeah, but otherwise, other than that, we really try to debrief amongst ourselves if we lose a patient, and this also just try to encourage ourselves, because you see, you cannot handle someone who's broken if you're broken yourself. So just encouraging within ourselves, going to counseling services, so that even when you go to the patient, we give and breathe hope into them.
So you guys are also challenged. So the battle is not only for those who are battling the disease, but also those on the front line.
For sure.
We hear you. And then speaking of that, Daktari, I know my viewer urgently wants to understand what are some of the preventive strategies. We know that prevention is better than cure. For sure. Everyone knows that. So what are some of those strategies they can do? Are there any lifestyle changes that someone can adopt, or help us understand that?
Yeah, for sure. So the top two risk factors for just about anything in the world is alcohol and smoking. So those ones increase your risk for breast cancer. So lifestyle changes, like you stop the alcohol, you stop smoking, cut weight, because the more obese you are, the more estrogen you have, then estrogen is a risk for breast cancer. So just being within your recommended weight based on your height is also very important. Then just early, like monthly self-examination. So every woman should learn how to do a screening, and so should every man. So that if your woman does not know, you'll go and teach her. Hata kama ameshika vibaya, you also go and help her, you improve her skill of doing a self-breast examination. So this one is very important, because the husband can teach the wives will teach the daughters, and the daughters will teach each other. So it's very, very important to know how to screen. A very important thing to note is that the combined oral contraceptives, that is the family planning, does increase the risk for breast cancer. However, of note, it reduces the incidence of ovarian and endometrial cancer. So overall, if you compare the amount of breast cancers it causes versus the amount of endometrial and ovarian cancers it reduces,
Yeah.
there's an overall advantage in reducing the cancer incidence. Not that if you say that if you've taken family planning, you will get breast cancer. So it's very important to put that into perspective.
I think it's very important to put that into perspective because people will go away with such information. You know, we have a challenge. People can cut out short videos and tell people, doctor said family planning is not good, can bring cancer, but that's not right. Yeah, he has alluded to it and given us the alternatives even to family planning. There's not only one method.
Yeah, for sure.
Yes. Dr. Speaking of lifestyle changes, we are challenged in these days because realize we see a lot of cancer cases among the young generations, 20, 30 years, more so in this country. So could you say a word to probably the young people because they're exposed to social media? I know you talked about exercise and things like that. Social media screen time is a bit longer. The kind of foods that we are exposed to, maybe when they hear it from you, they can probably take you serious.
Yeah, for sure. I believe that cancer has been here, only that previously it has been a bit harder to diagnose. That is to say, in Africa, some of these technologies came a bit later. So someone will just die and then you won't get your company cancer. So that being said, also nowadays there's been a lot of change. So things like the food we eat, like the genetically modified foods, like lack of exercise and whatnot, smoking and drinking is also very rampant in today's society. Such things increase the incidence for cancers in general. So having like a paradigm shift into our lifestyle would also clearly reduce the incidence of these things. That being said, we cannot accurately predict that this person is going to get breast cancer. Some of the common rebuttals people usually say is that I know someone who smoked for 50 years and never got lung cancer. My answer usually is if someone told you that there's a 1% chance that if you smoked, you'll get, for example, lung cancer or breast cancer, would you want to be part of the one?
Why would you want to involve yourself?
Who would want to gamble that I'll be part of the 99? So even that one person for us, it's very painful because there is the social aspect of it, because this person also has dependents, has loved ones, has relatives. So it's our job right now to try reduce the risk factors and the predisposing factors towards this cancer.
Very interesting. Dr. You will allow me and our viewers will permit me. This is off script.
Yes.
We have seen doctors who are really, smoking, and then you guys tell us do not smoke.
Do not smoke.
The other day I was on social media and someone was like, me I'm smoking, and he was being interviewed. They asked him, what did your doctor say? He said, my doctor is dead, but I'm living.
Yeah, so as it said, don't do what I do, do as I say. So these things also, like I said, there's also the social aspect of things. So it is your job to be told what the truth is, and then from there you make an informed decision. Yeah.
Wow. For those of you who are following us, this is again Faith Today Television. He talked about self-examination. I know those of you who didn't get a clear picture of how you go through the entire process. This is information on Jessica Hospital page, Facebook. You can go there. We are going to upload it. They have sent me a text. You'll have to get to understand how it is done. Dr. Questions are coming in.
Yes.
I'm Emma from Embakasi.
Yes.
Do I need to get a second opinion after being diagnosed?
Yeah, second opinion are usually advised if you do want one. So there is no like a hard line that once you've gotten a diagnosis from one place, you cannot get a different opinion from somewhere else. However, that being said, for the most part, for a diagnosis of breast cancer to be made, like I said, it is multidisciplinary, starting all the way from a self-exam to a clinical exam. Then you do the ultrasounds all the way to the biopsies and then testing by pathology. So usually it's very hard for them to miss a diagnosis like that, or rather misdiagnose you. So yeah, the second opinion is okay if you do want to get if you want to get one. However, it's very rare that your doctor would have made a mistake in that regard.
Wow.
Because it's multidisciplinary. There's not just one person. It's a whole team.
It's a whole team on this war against breast cancer.
For sure.
Interesting. I have Helen here. Helen is saying, how often does cancer come back probably is asking a question. Let me say, someone who was diagnosed with breast cancer, they went through the process like you told us, and then they got healed. So she is asking
The
how
recurrence
often
rate.
the recurrence rate.
So I don't have data for the Kenyan setup because
Yeah.
also Kenyan and data and follow-up of patients is not very good. But if you can't check on the incidence and the recurrence rates on the internet, just Google them. But you'll find most of the data is from the US. Sometimes cancer might recur, a bit rare,
Yeah.
but it might recur. That's why you do have other therapies. Like you can, after you've been treated, you can do another round of chemotherapy just to clear all the remnant cells of cancer. So yes, it might recur. For the particular numbers, you might check. Just Google it on the internet. You'll find the numbers of the US.
Okay.
Yeah.
And that is interesting because doctor talked about this a bit earlier, that for those of you who have been treated against this, now stand at the guard, you know. You have to prevent, do the lifestyle changes like he told us, do the exercise, take enough sleep, avoid these junk foods, you know, and be healthy. Daktari, the questions are coming in through, but I feel we can't end this now. As we are taking our, as we conclude this, you guys have been running something serious that I take very also important. The You First campaign. What is the You First campaign at JCK Hospital?
So the You First campaign at JCK is basically tailoring care, having your patient as a first priority. So all the way from when you walk into the gates, when you meet the watchman, all the way to the reception, and everybody will handle you until you see the doctor, and after you see the doctor, all the way to the lab and to the pharmacy. It is patient-centered. Everybody is willing to help. Everybody is putting the patient as a first priority. So that is a brief overview of the You First campaign. And JCK has been, as part of that, has been doing so many outreaches, so many medical camps. We've had a dental campaign just recently. This whole month we have breast cancer awareness, so we have subsidized prices. And we're doing so many outreaches just to put ourselves out there and for our patients to know that we do care. It's a mission hospital like you guys know. So it's not all about money, but it's about helping the patient and patient care. As you guys know as well, JCK caters to the Happy Life Children's Home. So it's a place that, as you can clearly tell, the values and everything is that they put the patient first, and then also just doing everything according to the Christian values.
Oh, thank you so much, JCK Hospital. As we wrap up this, just in, should I say one word or a few seconds, what is your call to action to our audience, if you look to the camera?
So the call to action and the take-home message from today is this: men and women are both involved in the diagnosis and the screening of breast cancer. Do not ignore any lumps, do not ignore any skin changes in your breasts, don't ignore that nipple inversion. So learn how to diagnose breast cancer and do the self-screening, and also teach someone else. So not only yourself, if you watch today, make sure when you go back home, meet your friends at work, teach someone else how to do a self-breast examination. Then the key word here is 3 to 5 days after your menses. That is the best time to check your breast for any lump or any changes.
Wow, thank you so much. That is Dr. Austin from JCK Hospital. For your time and your expertise, we are really grateful. And for those of you who are watching this, we have learned that breast cancer is not a death sentence. Early screening is very important. Doing the examination, early detection is very key in this kind of fight that we are all engaged into. And for those of you who are in hospital and you are under any form of treatment for breast cancer or any other disease, we pray for you that may your healing come forth speedily. And if you believe this, you can say amen or type amen in the comment section. My name is Enock Kitondekijja, and this is the Healthy You program on Faith Today Television. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.